Good day and welcome back to my channel. My name is Quincy. This is Health Matters with Quincy. So today, guys, we're talking about diabetes. Yes, diabetes. So before talk on that, I want to tell us something. Having an illness, an infection, or disease is not the end of the world. What will become the end of the world is when you decide not to take treatment or manage that particular illness. What we should always do when we find that we have some certain things like this, we should seek ideas, seek knowledge, learn things, watch videos, watch things online that will help us legit things online that will help us manage that particular illness. And you see, you tend to get better. Many people, millions of people are living with one disease or the other, one infection or the other, but they are managing it. That's the reason why they're still living and alive. So, like I said earlier, we'll be talking about diabetes. So, under it, we'll be talking about the definition, the types, the signs and symptoms, and the way to manage them. I'm just going to give us like a summary, like an overview of diabetes. We'll keep making more videos concerning diabetes. So, diabetes can be defined as a chronic disease condition in which the body doesn't produce enough insulin, or the body doesn't make effective use of the insulin produced. We also have insulin. Insulin is a hormone produced in the pancreas which regulates the amount of glucose in the body. So when there's an issue or when something tampers with this insulin, it leads to diabetes. Types of diabetes: we have type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes is also called insulin dependent diabetes. This is when the body doesn't produce enough insulin. Type 1 diabetes is when the body doesn't produce enough insulin. Then we move over, we have type 2 diabetes. This is when the body doesn't make effective use of the insulin produced. Type 2 has to do with not making effective use of the insulin produced. And then we have gestational diabetes. This diabetes comes during pregnancy in women, but most times after childbirth, the thing leaves. After childbirth, they do not experience this diabetes again. But in most cases and in most women, most times after giving birth, this diabetes still continues. Okay, we move over to the signs and symptoms of diabetes. We have urinating and peeing more often. Most times in the night, we notice at least we get up 2 or once in the night to ease ourselves. But for a diabetic person or patient, the person tends to wake up almost all the time at the night to ease his or herself. Then we move over, we also have blurry vision. Diabetic patients always have problems with their sight. Majority of them are always on glasses because it has clouds their eyesight. So we also have what we call always hungry. They are always hungry. Yes, diabetic patients always tend to get hungry. We also have always thirsty. They are always thirsty. They get tired easily, always tired. We also have dizziness. They tend to get weak or dizzy most times after doing just little activities. We also have numb feet and hands. Diabetic patients are known to have poor blood circulation or blood supply to the tips of their fingers and then to their foot also. So when there's poor circulation, they tend to get numb. It tends to get numb at times. Then we have slow healing of wounds on the leg or on the legs or on the feet or any part of the body where there are wounds. Also, diabetic patients are known to have injuries. That's why they should always avoid injuries on their feet, on their legs, on anywhere, because they, due to the poor or the slow blood circulation to that place, the wounds tend to heal slower. So they are known to have, diabetic patients are known to have slow healing of wounds. We also have loss of weight. They tend to lose weight. Most of the time is when they find out they have diabetes at the early stage, or when they don't even know the thing is actually eating them inside, because it has to do with sugar levels. So when the sugar levels are not well maintained, the person tends to lose weight. Then we have the ways to manage diabetes that I listed out from my experiences, both in my post in the hospital and from things I've seen around me. So first off, you have to always check your blood sugar level. If you are with someone who has it, always check their blood sugar level to know the stage or to know the level at which it is at, to know if to take drugs, rest, or food or anything. So we also have change of diet. When one has diabetes, that the diet, the food he or she eats will be changed. You don't have to eat everything. The doctor tells you things not to eat, so it won't trigger your diabetes. We also have exercising. Most people tend to, whenever they become sick or ill with an illness, they will just stay at the place. No, when you have diabetes, please exercise. If you have any illness, please exercise to be able to, because once we exercise, our body keeps moving, but once we start a place, our body just tends to start a place, and I don't think that's progress. Then we also have avoid wearing tight fitted shoes. Like I said earlier in my signs and symptoms, that they have slow healing of wounds because of poor blood circulation to their feet and their hands and their legs. So what you do is avoid wearing things that will constrict the little blood supply that goes there. So wear things that are open, wear open shoes. Do not wear cover shoes. Wear open shoes. Wear open slippers. Don't wear things that will constrict the blood supply there. We also have medication, and it's very important. The medications, always take your medications. When you go to the hospital, the doctor recommends drugs for you. We have drugs such as metformin, glucosamine, granule, Amaryl. There's so many others, but I'm just listing the ones I have an idea of and I know of. So I've come to the end of what I have to say for diabetes today. I'll still be making more videos, but